Hi everyone, my name's Gianna Reyes and I did my disorder on Cri-Du-Chat. It's a French descent, which is where the name comes from, but a lot of people tend to mispronounce it as Cri-Du-Chat because that's how it is spelled, but I think it's important to clarify how we say it before we move on. So, Cri-Du-Chat is a syndrome that affects a child's growth and development, and it is caused by the deletion of the short arm in chromosome 5. So, a majority of the time when you see information regarding this syndrome, you will see what they refer to. It's a 5, a P, and a minus, and this signifies the change in the chromosome. So, rather than constantly being like the deletion of small arm in chromosome 5 or half of chromosome 5 missing, it's just 5P minus. I actually made a chromosome 5 because I feel like I'm a visual learner and I think visuals help. It's not the best chromosome 5, but it's better than nothing. So this is a regular chromosome 5. This is the short arm. Take this away, and this is Cri-Du-Chat. Normal, Cri-Du-Chat. So I want to talk about the size of the deletions. The size of the deletions have been correlated to the severity of the symptoms in individuals suffering with this. So the bigger the deletion, the more severe the symptoms are. The smaller the deletion, the less severe the symptoms are. There's been studies that demonstrate this, but this does make sense. The more of the chromosome you're missing, the more severe your symptoms are. That makes sense. Before we start talking about the signs and the symptoms, how you get Cri-Du-Chat, I want to talk about the history of Cri-Du-Chat. So, Cri-Du-Chat is first mentioned in the medical literature of 1963 by Dr. Jerome Lejeune. And he named this disorder after a cat-like cry. So in French, Cri-Du-Chat translates into cry of the cat. When I first heard this, I was like, what? But it makes sense, I promise. And it's going to make more sense when we talk about the symptoms of Cri-Du-Chat a little later on. But keep in mind where this name comes from. So in most cases, Cri-Du-Chat is not an inherited disorder, but that's not to say that it can't be inherited, because it can. A lot of the times it randomly happens during embryonic formation or in each respective parent when a mother is ovulating, during egg creation or egg formation, and in a father when sperm cells are being created. It happens randomly. While I said that it doesn't happen in most cases, it does happen in some, 10 to 15% to be exact. In these cases, a parent carries what is called a balanced translocation. So this is a chromosomal rearrangement where no genetic material is gained or lost, while the parent who carries this balanced translocation isn't necessarily impacted negatively in terms of health or intellectual abilities, psychomotor abilities. They don't have a normal chromosomal arrangement. So while this might not be showing itself within them, it's going to show itself later down the line when they go to create a family. And it will show itself in the form of an unbalanced translocation. So the unbalanced translocation means that the child has missing or extra genetic material. So individuals suffering from Cri-Du-Chat have what we call an unbalanced translocation, but on chromosome 5. They are missing genetic material from the short arm of chromosome 5. I keep saying chromosome 5, so I want to put into perspective the importance of this chromosome and Cri-Du-Chat. So chromosome 5 is the 5th largest chromosome of the 23 chromosomal pairs in human beings, and it's representative of 6% of the total DNA. So while you may think 5 isn't one, out of 23, that's pretty major. The populations that this affects are, so it's important to talk about the rarity. the rarity is something we need to talk about, because there's not, when you go to research Cri-Du-Chat I have for this presentation, it's a lot of the same information. Different websites, same information, worded differently. Because Cri-Du-Chat is so rare, there hasn't been that much research conducted on it. Not too much is known. The whys, hows, because, okay, so it affects about 1 in every 30,000 newborn babies. Babies are born every day, so only 1 in 30,000 of them is going to suffer from Cri-Du-Chat. That shows us how rare this is. And it tends to affect females more than males. So now I say that because it's so rare, we don't know a lot about the hows and the whys, and this is what I'm kind of referring to. I tried to find information on why it affects females more than it affects males. There is no information on that. All that was said was these cases do go undiagnosed, so it's hard to tell what the actual frequency of Cri-Du-Chat in these populations is. But the cases that have been diagnosed, there is frequency in the female population in comparison to the male population. So there's no exact why a female is affected more so than a male, but that is the case as of right now. So just like any other disorder, the symptoms of Cri-Du-Chat vary depending on the case. A major telltale sign of Cri-Du-Chat, bringing it back to the history, is a high-pitched cat-like cry, and this is present during the first few weeks of life. This cry fades away with age. So infants not only have this high-pitched cry that is basically the giveaway of Cri-Du-Chat, but they have low weight at birth, they have hypotonia, which is weak muscle tone, microcephaly, which is a condition that indicates that the size of the head is smaller than expected for the infant's age and sex. There are distinctive facial features, and there are a lot of facial features that are mentioned in relation to Cri-Du-Chat, but I'm going to mention the most prominent ones. So people with Cri-Du-Chat have what we refer to as a moon face. So we have definition right here with our jawline. They have just a full rounded out face. This is typical during younger ages. As they get older, their face actually gets longer and narrower. So they have a flat nasal bridge, widely spaced eyes, cross eyes, downwardly slanting eyelid folds, low set ears, an abnormally small jaw, improper alignment of the upper and lower teeth. And I think it's important to mention that not all of these characteristics are necessarily evident in each person with Cri-Du-Chat. An individual may only have widely spaced eyes, a flat nasal bridge, and a round face, while the next person may have a round face, a small jaw, and downward slanting eyelid folds. But I will say, in doing my research for this project, I did see that a majority of people with Cri-Du-Chat do have the moon face at a younger age, wide spaced eyes, a lot of dental issues going on, whether it be improper jaw alignment, a small jaw. There is dental issues going on in a majority of the individuals. While these are only a few of the distinctive features, there are many more in that they range from an abnormally small distance from the upper lip to the nose, and a bifid uvula, which is when the uvula is split into two. Way less common, but there are a few more. But the ones that I mentioned are the key ones. These are what is found in almost all individuals suffering with Cri-Du-Chat. So aside from the effect of Cri-Du-Chat on the physical features of an infant, it also affects infants' psychomotor and intellectual development. So psychomotor references the connections between mental and muscle functions. When an individual has a psychomotor impairment, which is what happens with Cri-Du-Chat, there's a disruption between these connections. For an infant, this would show itself in the form of delayed walking, crawling, sitting up, controlling his or her head, Intellectual development is impacted moderately to severely in most Cri-Du-Chat cases, and speech is impacted the most. Children tend to understand the speech that's spoken by others better than they can speak it, but both the comprehension and the act of actually speaking are delayed. Children with Cri-Du-Chat are also overly hyper, and this displays itself in the form of self-inflicted injury. So if I were sitting here and they would do this, pull their own hair aggressively, pull their skin, and these are only two examples of how they inflict injury upon themselves. But I did find a website, and the website was called FIND, and this stood for Further Informed Neurogenetic Disorders. This website offered a lot of information on the type of injuries that these children inflict upon themselves, which I found interesting and I want to share. So a doctor named Dr. Kate Aaron and her team, they're from the UK, they conducted research on individuals with Cri-Du-Chat, and they found that these individuals are around 9 times more likely to show self-injurious behavior than individuals suffering from a different type of intellectual disability. The most common form of self-injury is pulling hair or skin. Hitting oneself with an object is the second most common form. The third is rubbing or scratching oneself. Fourth, hitting oneself with your body. And fifth is hitting oneself against objects. Sixth is biting oneself. So I think these are really interesting and they're good to know, because if you see it and you'll know what's going on. This isn't abnormal. This is actually very normal for individuals with Cri-Du-Chat. So I want to quickly go back to hypotonia, the weak muscle tone in infants. The lack of muscle tone in infants can lead to difficulties when it comes to feeding. Because the infant is weaker than the normal infant, they can have a poor suck when it comes to breastfeeding or bottle feeding, and acid reflux is also typical in infants with Cri-Du-Chat. And this increases the chances of the infant obtaining pneumonia because the risk of aspiration, which leads to pneumonia, is higher with acid reflux. Although with age, children with Cri-Du-Chat do go from being hypotonic to hypertonic. So quite literally two different extremes. They go from weak muscle tone to having a lot of muscle tone. I can go on and on about additional findings that are associated with Cri-Du-Chat, but I'm going to touch on one more that I believe is worth mentioning due to the fact that we are all aspiring to go the route of speech pathology or audiology. Children who are affected with Cri-Du-Chat are at a higher risk for ear infections and hearing loss. Therefore, a child with Cri-Du-Chat should be monitored closely to help minimize the impact of this disorder on development. So they shouldn't just be monitored because of the possible hearing loss. They should be monitored all around. Early intervention, which is what we're going to get into, because early intervention will help a lot. So Cri-Du-Chat is diagnosed in a few different ways, and it's typically diagnosed in the hospital at birth. A doctor or a nurse will conduct an in-depth clinical evaluation and note the clinical symptoms that are associated with Cri-Du-Chat. Baby's born, high-pitched cat-like cry, small head, low weight, Cri-Du-Chat. Connecting the dots during this clinical evaluation. The cat-like cry is the number one indicator of the disorder, which the name, Cri-Du-Chat. Another way Cri-Du-Chat is diagnosed is through what we call karyotyping. Karyotyping is a test conducted to examine chromosomes in a sample of cells. So this can reveal the deletion on chromosome 5. There's also a test referred to as FISH, and this stands for fluorescence in situ hybridization, and this test can also confirm a case of Cri-Du-Chat, although FISH is typically used to confirm cases of cancer. That is if the karyotyping does not pick up on the deletion. Then you will go to FISH. So for Cri-Du-Chat, there's no specific treatment as of right now. Treatment is directed toward the symptoms of the individual with Cri-Du-Chat and what they're experiencing. Children who are born with this disorder will most likely require ongoing support from a team, including but not limited to therapists, surgeons, dentists, neurologists, occupational therapists, pediatricians, audiologists, and speech pathologists, depending on his or her symptoms. The team of the individual will come up with a plan of treatment that best suits the child in question. And then this plan of treatment will be worked through. So early intervention in Cri-Du-Chat is important because it's important when it comes to any illness. But with early intervention, a child has a better chance of reaching his or her highest potential. So it's actually suggested that children suffering from Cri-Du-Chat are enrolled in therapy before even hitting 12 months of age, so before 1 year old. While there is no specific treatment, preventative measures can be taken with the right treatment plan, which is why early intervention is so important. And it's also important that the children and their families that are affected by Cri-Du-Chat feel supported, feel understood, so counseling is also always something that is recommended for families that are going through Cri-Du-Chat. I want to specifically talk about the connection of Cri-Du-Chat and speech pathology. So a speech pathologist would help a child with Cri-Du-Chat to communicate, carry a conversation, make important facial expressions in conversation, and speak clearly. This is something that is an issue with Cri-Du-Chat because language is so delayed. So a speech pathologist would be extremely vital in the treatment plan of an individual with Cri-Du-Chat. Overall, a speech pathologist would help effective communication between a child, family, teachers, peers. It's also important to note, this is very important, that working with a speech pathologist would also help a child with Cri-Du-Chat work on their eating and swallowing, because that is a focus of speech therapy. So this brings us back to hypotonia, muscle weakness. The focus a child would have on eating and swallowing is super important to make sure he or she is getting all of the nutrients they need. Working with the speech pathologist early on is very important since most children with Cri-Du-Chat do have significant speech delays and have issues with feeding due to hypotonia. And lastly, a fun fact about Cri-Du-Chat that about in 80% of Cri-Du-Chat cases, the chromosome carrying the deletion comes from the father and not the mother. It's always guys. But I hope you guys enjoyed my presentation on Cri-Du-Chat, and that is all. Thank you.